The Royal Centre for Disease Control would like to present to you the procedures for donning and doffing of personal protective equipment for collection of specimens from a suspected COVID-19 patient. Donning should be carried out in a clean room, preferably near the specimen collection room, while doffing should be mandatorily carried out near the specimen collection room. Before you begin, please check that all required items are gathered. First, the shoe cover with waterproof boots, gloves, at least 3 pairs per individual, coverall, N95 mask, head cover, eye shield, alcohol-based hand rubs, and biohazard bags. Also ensure that the person collecting specimens is in good health and is competent in performing the procedure. To begin with, wash your hands with soap and water and remove watches and other non-smooth jewelries like bracelets. Make sure your street clothes are removed and that you are wearing a surgical scrub. Put on the boots and then put on your shoe cover. Perform hand hygiene. And put on inner pair of gloves. Put on your coverall or the apron. Make sure it is large and allow free movement. Ensure the cuffs of inner gloves are tucked under the sleeves of the coverall. Put on N95 respirator by cupping the respirator in your hands with the nose piece at the fingers. Position the respirator under your chin with the nose piece up. Pull the bottom strap over your head and place it around your neck below the ears. Then, pull the top strap over your head and rest it high at the top back of your head. Place your fingertips from both hands at the top of the metal nose piece. Using 2 hands, mold the nose piece to the shape of your nose by pushing inward while moving your fingertips down both sides of the nose piece. Perform seal check by inhaling deeply and feel the respirator slightly being sucked in. Also, exhale sharply and feel the respirator slightly bulge. Then put on your outer gloves. Pull the edge of the gloves over the cuff of your apron. Put on hair cover. And then put on your goggles. Now the donning of PPE is complete. Make sure the person is able to extend his or arms, bend at the waist, and do a range of motions. Now we move on to procedures for removing and disposing of PPE. First, inspect your PPE for any visible contamination or tears. Then disinfect your outer gloves. Remove boot covers by touching only the inner surface of the boot cover. Remove your outer gloves. Take care not to contaminate the inner gloves. Inspect and disinfect inner gloves. In case your inner gloves are contaminated or torn, disinfect, remove and wear a new pair of gloves. Remove goggles or face shield by lifting back strap over your head. Avoid touching the front portion of goggles or face shield. Disinfect the inner gloves. Remove your coverall or the gown. Untie the knot first and pull it inside out by pulling the sleeves. Discard the gown in the biohazard bag. Disinfect the inner gloves. Then remove your hair cover. Again, disinfect your gloves. Remove your N95 respirator. Place the respirator in the biohazard bag. Disinfect your gloves. Disinfect your washable boots and remove them. Disinfect and remove the gloves. Wash your hands and forearms with soap and water.